marks. So you just like say currently.
Yes, sir.
Yeah, sure. So the first half is like very technical. So we have like the history part in the first unit, and the second is like research. And the third is also like related to research. The fourth is like biopsychology and biological basis of behavior, and we have like cognitive psychology in fifth and sixth units. And from here it gets like less technical. So it gets like kind of subjective. Yeah. So the first 5 units are very technical, so they're like more objective. So you'll have like only one correct answer, and there'll be like no ambiguous questions from here. So from the seventh unit onwards, you may get like some ambiguous questions like therapy oriented or about psychopathology and such. So seventh one is about personality and motivation, emotion, and even coping. So eighth is social psychology, ninth is developmental psychology, and also psychopathology. We also have like treatment and therapies included in this as well. And last is a new addition, and if you know like from 2019, they added a lot of new units into NET. So one is this the emerging areas. So this is like something that is like very difficult to get a hold of because it's mostly from internet sources. So they don't have exactly any references for this. Okay? But anyway, we'll try our best to cover this as well. Okay? So since the first half is entirely technical, if we go like from first and second and third and all, you guys will definitely get bored because it's like too technical and dry. So we're gonna mix it up. So we're gonna start with definitely we're gonna start with research, and we're also gonna start with cognitive psychology, which is kind of less technical. Okay, so at least like it is a bit not too dry. Okay, so we're gonna start with the first unit from our side, which is going to be like research, right? Let me know if you can like see the PPT here. So the syllabus will be shared with you. So we're going to start with the class. So I guess like you can keep yourself on mute if you're not already on mute. So someone said you did your MA in counseling. Yeah, you should be eligible to write NET, even though you need some distance thing. So there is no criteria. The only criteria is that you have a master's in psychology and also like 55% at the time of graduation. So nothing else. Anyway. So we're starting with research. The reason I'm like focusing more on research is because so there is one section in the NET paper. So you definitely get like almost 10 marks from research, and they'll be of a particular format. Okay. So if you know everything about research, you like get those 10 marks easily, and those 10 marks translate to 20 marks. Sorry, 10 questions translate to 20 marks. Okay. So each question carries 2 marks. So if you're able to like be thorough with research, you'll easily get those 20 marks because they're of a particular format. They'll give you a particular statement or like a story, and they'll be asking you about what is the research designed here, or they'll be asking about what is the various statistics that can be used here, right? So we're going to be like starting with research, and we'll be focusing more on research because it's something where you can easily score marks, and the question is also very objective, right? So there's no subjective or ambiguous questions here. So that is why we're stressing on research again. So yeah. So the syllabus says research, meaning, purpose, and dimensions. Okay. So we are following a particular reference. So we'll share that reference as well with you. So for now, we'll just like start with the meaning of research. So research is basically it's a disciplined inquiry. So they call it it's like a systematic investigation. So which studies the underlying guidelines, right? So despite any research paradigm, you can like take qualitative research or you can like take it like quantitative where you measure things, right? So despite whatever paradigm you're using, so it is going to systematically investigate a particular phenomenon. So that is what they call as disciplined inquiry. Okay? So inquiry is like a systematic investigation where you seek knowledge or gain more knowledge, but in a more scientific way. So these are the definitions of research. So not many questions come from this meaning part, but it is like best to know this. So that like even in paper one, So they'll be asking more about research. So if you know about the definition and such, you may be able to answer some questions in paper one. So anyway, we'll move on to the next part. So this is the meaning part. So hope you will know about it. So research has broadly two general purposes. So the first main purpose is, so that is what we would consider the knowledge base, right? But these things have been like found out decades earlier. So if you want to like translate them into the current century or the current year, they will not be entirely appropriate. So we have to keep updating our knowledge base and also broaden our knowledge base. So there are a lot of things which we currently are not in know about. So research, or the main purpose of research here, is to broaden that knowledge base. And the second one is to increase your own self knowledge as a professional. So you can like use it so that you can apply them in a professional setting. So if you're like a counselor, so you can like research about which counseling process is more appropriate, or which counseling model, or which therapeutic approach is more appropriate for a particular phenomenon or a particular disorder or something like that. So you can like use those self knowledge as a professional tool. So coming to the first purpose, so there are like three sub purposes. So one is for theory development. So when you talk about increasing knowledge base, the first one is like to develop a theory. So theory is something that gives you an explanation for a phenomenon. Okay. So theory represents interrelated concepts. It represents definitions, also propositions about a particular phenomenon. So they're like assumptions, okay, or something that can explain a particular phenomenon. So by increasing the knowledge, you try to develop theories. You try to develop these propositions that can help you explain a lot of phenomena. Okay. So one of the main purpose of research is theory development, and by developing theory, you are able to test a theory. Okay. So here usually to test theory, we divide people into two groups through random assignment, and we'll like see whether these two groups are different. So if you have a theory that extroverts are like happier in life, or if you have a theory that introverts are like high in I don't know, emotional strength or something like that, so you can like, that is a theory. So you can like test that theory using like random assignment into two groups, and you can like study them using a particular measure or something. So that would be theory development. So practical application is where you take that knowledge and apply into a particular setting or a particular real world problem. Okay? So this provides evidence for like, let's say, efficiency of a curriculum, whatever treatment you have. So it's about how efficient that particular treatment is. Okay? Or if you're going to bring about a particular managerial change in your organization, so is that going to be effective, or is that going to be like not so effective, right? So that is like a practical application. So here, after randomly assigning that we discussed in the theory development, so you'll randomly assign a group of people into experimental and control. You'll take measurements of those people, like their achievements or their ability. So if you're giving a group of people a memory training technique or something like that, okay? And what happens is you're going to see how effective that memory training technique was or is going to be. So what you'll do is you'll separate the sample into two different groups. So one is experimental, the other is the control group. So the experimental group gets the memory training technique or the treatment, and the control group is given or is waitlisted. So we cannot give placebo in psychology. So they'll be waitlisted, and after that you'll be seeing whether the experimental group is different from the control group. Okay? So if they are different, you can say that the memory technique was effective. So then you can say we can give this memory technique to people and people will benefit from it, right? So that is the practical application part of research. So control group is where like usually in control group we will not be giving them any treatment, but it is not ethical to not give them treatment. So here control group would be like waitlisted candidates. So let's say you have 50 people in your research. So 25 are allotted to the experimental group. So they are given a treatment. To compare their effects, you'll have a control group who are not receiving the treatment yet. But ethically, they should be receiving the treatment soon enough, because You cannot have someone in your research just for the purpose of having it. So if there's going to be like a treatment, they also need to get the treatment. Okay, so they are waitlisted. So usually the waitlisted group is the control in our research setting or experimental designs and all. So the third purpose is to develop research tools, right? So we are dealing with behavior. So behavior is something that is kind of like difficult to measure, especially if it's something that is, covert, like a person's depression or the level of anxiety, right? So we need like reliable tools. So we need like valid tools. So using these like research, so you can like create tools. So the Beck's inventory for depression, right? And you may like know state trait anxiety inventory. So that is to measure like depression and anxiety respectively, right? So these things were like a product of research. So they were not developed just by like guesswork. So there was like a lot of research that was put into it. So one of the other purpose of research is to develop research tools. Okay, so these create like methods to assess behavior, or that is like a self-report technique, right? Or you could come up with a checklist to like, let's say, diagnose autism or a particular disorder that just came right now. Let's say gaming addiction or something like that. So you can develop a checklist, or you can develop a screening tool, or you could develop a self-report questionnaire. So all those things can be developed so that behavior can be assessed or it can be measured. Okay, and of course, whatever this assessment tool you create, it will have to be like valid and reliable. So that is where like more research and statistics are involved. So these are the three broad purposes of research. So this is on one end. The other end, you have like improving your own self-knowledge as a professional. So by conducting more and more research, you gain the ability to understand and evaluate research in a discipline that could be like more important. Okay, for some people, like research and day-to-day practice goes hand in hand. So they have to be like in touch with whatever is happening right in the world, in the research world. So otherwise, they may not be efficient. So for them, it's more like gaining, knowledge for the sake of gaining. Wherever application is possible, they take those things. So one is that. So these are the two broad categories of research, and within one category, you have theory development, practical application, and developing tools. Hope that was clear. So we'll be moving on. If you have questions, do put it in the chat box. So now we'll be moving on to the dimensions or dichotomies of research. So you may have like heard research as like applied versus basic and all those things. So we have like various categories or dichotomies to slice research into or like categorize it into. Okay, so we're going to like talk about 6 dichotomies. The first 3 are in the slide and the next 3 are in the other slide. Okay, so the 6 dichotomies are this. So one is theoretical versus applied, and we have like laboratory versus field research. So the other one is about participant report versus researcher observation. Okay, so these are all based on a particular dimension, how they can be like categorized. So when you talk about theoretical versus applied, so theoretical research is basically just to gain knowledge. So as we discussed earlier, some people may just like gain knowledge for just for the sake of widening your knowledge base without any application. So for example, if you find out that COVID people are also more likely to stay at home rather than going out, so that is just a theoretical knowledge. So that may not like translate into application or not yet, right? So you do research that is only to like probably broaden your knowledge base, that may not have application right now or may have it like much later, but the sole purpose of that particular research is not to find applications or not to solve problems, but just to gain knowledge or to develop a theory which may not have applications. So that is what we call as theoretical research or basic research or even like fundamental research. So on the other end, you have applied research. So here the intent is to deal with a particular problem. So there may be a problem that needs a solution like almost immediately. If you take again depression caused by COVID or like the pandemic or being locked in your house or something like that. Okay. So how do we tackle them? So a lot of mobile apps came to the aid. So computerizing therapy or like digitizing therapy was one of the solutions. So here the research is about how efficient those digitized or computerized therapy would be, right? So that is called applied research. So we have the purpose of that research is to find a solution and to evaluate the efficiency of the solution. So where you apply that solution to a particular problem that is existing in reality. So that would be the first dimension, theoretical versus applied. And in the second one, it's about where you conduct research, okay, and how much of a control do you have in that particular setting. Okay? So research could be conducted in a laboratory or it could be conducted in a field. So laboratory, as in like we know a psychology laboratory. So I hope all of you are regular students, even if you're not. So psychology laboratory is a particular, just a room. Okay. So we do not have much of noise. So it has like a lot of ventilation windows. And apart from that, you have the proper tools, the proper equipments to measure a particular behavior or to study a behavior. Okay. Here, everything is controlled. So there is no distraction here. So there is no, forces of nature interfering, right? So it is a proper control structure where you study people's behavior, okay, or where people receive therapy or something like that. So if you're like studying effect of a particular drug on sleep, okay, you give them the drug and you ask them to go home and sleep. So that would not be a laboratory setting. So that will be like a field setting because you're asking them to go home, the natural setting of that particular person. Excuse me. So that would be a field setting. Okay. So laboratory setting is more controlled. You have more control of the variables and less distractions and all that. So that is like a typical laboratory setting. But in social science, that may not give you the entire picture. So in social science, that may not be always possible either. So we have like field settings. So where things are more ecologically valid, but they may not be allowing you to like control everything like very efficiently. Let's say you want to study the playing patterns of teenagers. So you'd go to the ground, you'd go to the school, and you'd study how the people are like playing, like in a football ground. How are the like teenagers interacting with their peers? How are they interacting with the coach or something like that? So you want to study their peer behavior. So if you bring them to the laboratory and make them like play there, that may not be entirely appropriate because just because they're in laboratory, they may not feel like playing, right? So because they're in the field, it is their natural behavior, and you'll be able to observe those natural behaviors in the natural setting. So field, observations or field research has certain advantages of over laboratory research. So those are the second dichotomies. And thirdly, we have like participant report versus researcher observation. So if we ask someone to report their own, feelings or their own behavior, so that is something called participant report. So you have like 50 participants in your research study, and to all of them, you give them a questionnaire, and they respond on a Likert scale or yes or no to particular statements. So they themselves are responding to that. So that is something called self-report or participant report. Okay. So they themselves either in writing or orally report about their attitudes, about their behaviors, or about how they feel and almost like their own personality or something like that. Okay. So this is participant report. So the drawback with this is they may be faking good or they may be faking bad. So they may want to portray themselves in a particular way. So they would report, they would not say the appropriate thing, or there could be a lot of stigma to it, or maybe taboo associated with the particular behavior. So they are not going to like report it. Okay? So participant report has certain drawbacks. So one is like social desirability and various biases. On the other hand, the researcher himself can observe behavior. Okay? So in the sense that if in a laboratory, you're asking them to do a particular task and you observe how frequently they're like, doing a particular behavior, right? Let's say the Bobo doll experiment, if you like know it. So that is kind of like a researcher observation. So the Bobo doll experiment conducted by Albert Bandura, if you can remember. So in that experiment, so they displayed, aggressive behavior by adults on TV, and children observed it, and they observed, the researchers, they observed children doing those behaviors, replicating those behaviors. So that would be an example of researcher observation. So, but if those people had asked children, are you feeling aggressive? Are you feeling like punching the bobo doll? So that would be like participant report. Okay. So researcher observation has like certain advantages in the sense that you get to observe the actual behavior instead of what they're reporting. So it could be like true to a certain extent, but the drawback is that it may not be always feasible. It may not be always possible. Just because a behavior is not occurring does not mean the person is not capable of it or something like that. Okay. That is the third dichotomy. So if you're going to observe someone directly, so that is researcher observation, and if you're going to ask people and like take that as data, so that will be like participant report. So that is one way of categorizing research. So now we have the paradigms. So we have quantitative or post-positivistic paradigm. So this is basically something that is more towards measuring things quantitatively using reliable methods. Okay, so that is like positivism. So we'll be like going back to that. So we'll be going back to that from in unit 1. So quantitative of post-positivistic philosophical paradigm is about measuring things. So it is about keeping track of everything. So to be like very accurate degree, right? So if you like use a lot of reliable tools, you'll be able to assess something. Okay. On the other hand, you have a qualitative or constructive paradigm. So all things cannot be studied numerically. All things cannot be studied like quantitatively. So there are certain things like things that are unexplored, right? For example, how does a person feel when they are depressed? So you cannot like measure that thing. So that has to be like studied qualitatively. So we'll like ask them to speak. Open-ended questions will be used. A lot of interviews will be used. A lot of open-ended questions will be used in the interview, and the interview will also be not entirely structured. So it will be like either semi-structured or unstructured interview. Okay. So the data analysis is more like about seeing the themes in their like stories instead of giving it numbers or something like that. So that is about qualitative research. Hope you're getting the distinction here. So this is the paradigm. So we're not talking about the data collection yet. So if you're going to conduct a research and you design the research to measure things that are quantitative, measure things in terms of number, so that would be the quantitative paradigm. And if you try to like study in depth, explore in terms of words and all that, in terms of their in depth experiences, so that would be like qualitative paradigm. So the next dichotomy is quantitative data collection versus qualitative data collection. So this is like tied up with the previous dichotomy, which is the paradigm. So in quantitative data collection, use objective methods, as in like you give them a questionnaire in which they can respond to how they feel. So in terms of so in terms of their behaviors, so they can like use self-report questionnaires. Okay, 1 second. So yeah, so you have like a lot of variables here. So like demographic details, like age, right? So that is a quantitative data. So age can be like varying from, let's say, of course it can range from 0 to almost 100 or anything. So it is a number that changes. Okay, so even gender, so it is not entirely quantitative, but even you can like give them 1 or 2 in terms of a code. So or your scores on like your semester exams, all right, or your IQ. So all those are quantitative data. So they are used to like give a particular behavior a number, right? Your intelligence is given a number, or your personality, right? It's given a number. So that is quantitative data. So you collect personality details or intelligence details in terms of numbers. So there's about data collection. So this is not to be confused with the paradigm. So on the other hand, if you collect data in terms of words instead of numbers, so we call them qualitative data collection. So if you ask someone like on a scale of 1 to 10, how painful does it feel? So right, so that would be quantitative data. And if you ask them to describe the pain, like numbing pain or like a sharp pain or something like that. They describe in terms of those words. So that would be a qualitative data collection. Okay? How you feel about a peer, or like how you feel about your organization, all those things are qualitative data collection methods, or like examples of qualitative data. Okay? So usually in qualitative data collection, you use a lot of open-ended interviews. Observations are used. So you observe them and note them down, and you talk about narrative documents like biographies, so diaries and all that. So those would be like qualitative data sources. So if you talk about quantitative, it is mostly about questionnaires, it is mostly about interviews that are highly structured. Even here observations are used, but they are like converted into numbers, or like numerical data. So this is the fifth paradigm, and now we come to the last one. So this is about analysis. So we talked about the research design being quantitative, we talked about the data collection being quantitative and qualitative. Now what's about the data analysis? Okay. So for quantitative data, we usually use inferential statistics, right? So inferential statistics, it gives the researcher ability to make generalizations about the population. For example, you get a sample, you want to study if the sample has like lower IQ than another sample. So if you want to see whether people with a particular disorder have lower IQ, or they have a particular personality trait apart from the normal population. So that would be a quantitative data analysis. You sample them, you give them a measure, they respond to it, and that is converted into number, and you compare mean of that group with the normal population. So you use a lot of inferential statistics like t-test, ANOVA, or various other things. So you make inferences from them. Okay? But qualitative data is entirely different. Here you use like data analysis technique like coding, and you see for themes that repeat. So here usually it is about mode. So we usually use data analysis is about mode. The central tendency here is mode. So central tendency in quantitative data is either mean or median, but in qualitative it's about mode. What is the theme that is like frequently reoccurring, right? So here the data is mostly like words or images. So you'll find like divide the entire narrative into various categories like themes. So that is about qualitative data analysis. Okay? So this is about research, its meaning, purpose, and dimensions. So we'll take a brief break here. So if you have any questions, you can like please do go ahead and ask. It requires like a lot of structuring, like in terms of defining the problem, defining what you're going to measure and how we're going to measure them, right? And how we're going to test it, the problem basically. So we're going to have to talk about research problems, the variables, operational definition of the variables, and of course, lastly, we have the hypothesis. Okay. So this is something which may have a lot of questions from. Yeah, so you can use qualitative and quantitative methods together. So that is something we call as mixed method research. So we'll be having that like in the upcoming like days, in the upcoming units. Okay, so there are like three different paradigms. So one is qualitative paradigm, quantitative, and mixed method research. So of course you can integrate both qualitative and quantitative. So moving on to this topic, so we're going to talk about problems, variables, and operational definition of the problems, and about how to test them. So that is the hypothesis part. So yeah, starting with the research problem. So it is the hallmark of any quantitative research. So even before a qualitative research, so you need to identify what you're going to study. So that is where the research problem comes in. Okay? So the first step in any research is identifying the research problem. So it is going to involve choosing a question so that has no particular answer, but can have an answer if you properly explore into that particular phenomenon. So it has a potential to be converted into a research project, is something what can be defined as a research problem, okay? But that's not the definition anyway. So research problem also comes from clinical situation. Let's say Freud, right? He was treating people earlier with, he was a doctor first, right? And then he observed certain disorders did not have any biological origin. Then he thought it must be like psychological in nature. So he got a research problem, then he studied it. Of course, he did not study it entirely scientifically. He did just like did a post test, and he did not have any pre-test or experimental or control group. But For him, the research problem came from the clinical situation. So that is also one source of research problem. Okay. Another place where you get those research problems is from existing literature. So a lot of people may have like already studied a phenomenon. Okay. If we talk about depression, if we talk about study skills, if we talk about any disorders, there may be already a lot of research papers or research studies that have already explored the phenomenon, but they may not have explored it entirely. So there may be like minor gaps in those particular literature. So that is where a new research problem arises. So what about this gap? How is this going to happen when this particular new variable is tweaked or something like that? So that is where you have a research problem arising. So to define research problem, it's usually framed as a sentence or a statement about relationship between two or more variables. Okay? So it's kind of like similar to hypothesis, but it's not necessarily so. You can, this is the definition of a research problem. So Kerlinger defines it as, like, prior to the problem statement, the scientist will usually experience an obstacle to understanding or a vague unrest, right? So that is what leads to the research problem. So that is what research problem is about, and there are various sources. We briefly discussed clinical situation, so there are other sources as well. So one is the existing literature. So I already told you. So there may be like a lot of studies on a particular phenomenon, but they may not be entirely complete. So they would have certain gaps. So let's say for phenylketonuria, so it is a particular disorder in which phenylalanine is converted to phenylpyruvic acid, and that leads to a lot of cognitive deficits, right? So for them, a diet that is low in proteins, especially phenylalanine, is administered. So that again like leaves a lot of questions unanswered. So if the person is on a diet in the early stages and then like back to normal diet, will the person be normal, or will they go back to having cognitive deficits? Or if they are entirely, do they have to be entirely on the diet throughout their life, or can they have like certain cheat days or something like that? So these are questions that can have an answer but are not entirely answered in literature. Maybe, and say there could be like research literature that have answered it, but not every phenomenon is completely answered. So there are like certain gaps in knowledge. So that is where you get research problems. So that is one source of research problem. Okay. So the existing literature is a source of research problem. And the second one is theory. So let's take psychoanalysis, right? So that again is gonna, if you apply it to any particular disorder, so you can like say, is depression caused by repressed memories, right? If it's from a CBT perspective, you will ask a question like, is depression caused by repeatedly focusing on negative aspects of our thoughts, something like that. So theory would guide your research question. So most researchers suggest that you need to have a theory first, and then draft your research, and then have a research problem. So even in like certain research papers, if you do not talk about the theory in the introduction part, people actually like not kind of they do actually reject the research paper based on that itself. But entirely, theory is not entirely necessary, but an explanation or rationale is more than enough for a research problem. But they are not as good as a theory. So if you have a theory and that theory is giving you a lot of questions or unanswered things, you can test it out as a research. So that is a source of a research problem. So even a minor explanation can take place of a theory or a rationale or a point of view, but they are not as strong as a theory. So theory is a second source of research problems. And thirdly, you have personal experiences, right? So this again, I could take the example of Freud here, even though it is also an example of clinical observation. So Freud in his personal experience saw that people are like, having this problems despite them not having any biological, origins. So that is from his personal experience, or he personally must have experienced something. So he talks about, Oedipus complex and all that, right? So Freud it is said that Freud did not have a very, open sexual life. So his personal experience may have caused him to build that theory or to solve that particular, part of his question, right? So in contrast, you have Carl Jung, who had a, very open sort of a relationship. So he did not focus much on the sexual aspect of development in psychoanalysis especially, right? So the personal experience can be drafted into a research problem. Let's say a person got affected with COVID, and then they had a particular mental phenomenon that they wanted to study. Now the person is like obsessed with that. So that is a research problem that they got from personal experience, right? So clinical experience is something I already like mentioned. So we took the example of Freud, right? Or let's say you're posted in a clinic, in a hospital, and you see a particular person with a disorder behaving in a particular way. If we talk about schizophrenia, and they have a tendency to go into catatonic state, so you may have a question like, why does that happen? Is it because they're having a sensory overload, or is it because they're tired? So you may have a lot of questions there, right? So that may come from clinical observation. So these are the various sources of research problems. So we know what a research problem is, and we also know what are the sources of research problems. Okay? So there are also characteristics of a good research problem, as in it has to be framed in a particular way. It should not be too broad. It should not be too narrow. Okay. So these are the characteristics of a good research problem. So one is that it should fill some gap in literature. So if it is going to be like something that is going to find the same thing. So if a person has studied and found out that people with COVID have depression in US, and you're doing the same in India, and it is seen that it is almost present throughout the globe, you're basically like repeating the same study over and over. So that is not a great characteristics of a research problem. It should be like finding some gap in the literature and filling that gap. So then it becomes a good research problem. So it should also provide a test of a theory. So if it is able to test a theory, that is again a good research problem. And to test that, it should be stated clearly and unambiguously. It should not be stated like, let's say taking a particular drug leads to a lot of things. You cannot let's say a lot of things. You should say like what things. So if let's say if taking caffeine leads to alertness, so that is like clear and unambiguous. But here again, alertness as in like what do you consider as alertness? You have to like define it more clearly or like unambiguously. Okay. So is alertness like lack of sleep, or is alertness being able to pick up minor changes in sensations and such? So that has to be like defined properly. So again, when you do that, it becomes testable. So again, testable is something that is tied with defining it clearly and unambiguously. If you're not defining it clearly, so that is not testable. And also the research problem has to be ethical, right? So if we talk about ethics, so there are certain principles we are supposed to follow. So that is also a topic in NET. So we'll be covering that too. So you cannot, if you want to study the gender differences, okay, between smoking, gender difference in smoking, and or gender difference in a particular drug consumption, you cannot change the gender of a person. That is not ethical, or that's not even like possible either, right? Or if you want to study the effect of COVID on mental health, you cannot give a person or infect a person with COVID, right? So you should not be basically causing the person harm and then studying. So there should be no harm caused because of the research study. So that is not ethical. So the research problem also has to be ethical. So it needs to be feasible also, in the sense that it should not be like something that cannot be tested, that cannot be conducted. So if you have a particular idea that world hunger can be solved by giving everyone money, donating everyone money. So even though it sounds logical, but it is not something that can be like feasible, that cannot be like tested, right? Or the last characteristic is that it should be of vital interest to the researcher. It's kind of like a no-brainer, because if it's not of vital interest to the researcher, it is something the researcher may drop off. It is something the researcher may not have interest to continue. So that is one of the another characteristics of a good research problem. So another way is like to see where it falls on the continuum. So if it is like too broad, again, if I say solving world hunger, right, it is something that is too broad. It is too broad of a phenomenon. So if it is like very narrow, it becomes very trivial. So again, it has like no appropriate applications from it. So you should choose a problem that is not too broad or not too narrow. So it should be somewhere in between, like Goldilocks, right? So not too on one side, not too much on the other side. So it should be like widespread, so that we have a lot of audience to it. So if you do that research and it is like of very limited interest, you may have a hard time getting it published. So there may not be like many journals that are like willing to publish it. But if it is too widespread, people would say this is the same thing that is again tested over and over. Why would I want to publish it? So it should be again like somewhere in between. So also you have like well-researched versus unknown territory. This is again like similar to widespread versus limited interest, but slightly different. So if it's something that again and again researched, let's say effect of exercise on mental health. So it's something that's like well-researched, okay? But if you talk about flow state or something like that in sports or something like that, right? So that is something like a new territory, right? Positive psychology and all are like kind of like still well-researched, but relatively newer. So if you like take up research in that particular area, so that would be like an unknown territory. So if you like go to the well-researched territory, then again we'll be having a hard time getting your research published. So a lot of people may not know that. So that is one of the main purpose of research again, right? To spread knowledge. So good research has to be like not too broad, not too narrow, not too widespread, nor very limited in interest. It should not be like well-researched, or it should not be like totally into the unknown territory. Like it should be like somewhere in between on all these dimensions, right? So yeah, that is about a good research problem. So these are the sources. So we saw what a research problem is, and these are the characteristics of a good research. So questions may come like saying a research problem is stated in this way. Okay, so is it appropriate or not? So of course it will not be yes or no question in net. So they'll be having like 4 different options. So they will be stated in a particular way. So when we give the MCQs, you'll get the hang of it. Yeah. So the framework is like this. So the research problem, as we stated earlier, should be like sort of broad, not too narrow. So it should be like using a lot of summary terms. So you should also have like certain variables that are fit into it. It should not be very vague. So it should be like convertible into a research hypothesis. Okay. So if you stated like the research problem is to study the effect of caffeine on alertness. So that is a research problem. If you say the research problem is to investigate the changes in mental health after getting affected by COVID, so that is again a research problem. Okay, so it depends on the number of variables you use. So depending on what sort of variable are you using research design where you experiment on people, or are you using a research design where you're just like studying relationship between two variables? So those are all the things that determine the research framework. Okay. So for here we have the example here. Research problem is to investigate whether independent variable 1, as in like being infected with COVID and also being vaccinated, has an effect on your mental health. Like not just mental health, you can like be more specific, saying that depression or anxiety in a population, you can like insert some people from India or old population or younger population. It has to be like specific. So that is how a research problem is framed. So now we'll move on to the variables and operational definition. No questions were asked yet. Yeah. So yeah, a variable is something that you'll be putting into the research problem and then measuring and then later testing it in the form of a hypothesis. So a variable is something that varies. So it is as simple as that. If it does not vary, it is a constant. So variable is what we wantedly try to vary. So that is something called the independent variable, or it is something that can be an effect, right? So that you're studying. So that can be what is called a dependent variable. Okay, or it could be something that is not controlled, but it is still present in your research. So something like an extraneous variable. So we'll be like defining that soon. So anything that varies is a variable. If it does not vary, it's a constant. Some examples are gender. So gender can be like male, female, or like there are like other genders as well, right? So they change in their quality. So that is a gender is a variable. So we have the type of treatment or intervention in an experimental setting. So one of them gets a particular, let's say if you're testing the efficiency of a particular vaccine, okay? So one of them gets vaccine 1, the other person gets vaccine 2. So you change the kind of treatment that they get. So that is also a variable that varies. So the number of days a person takes to learn something new, so that could also be a variable. Okay. So we have like various kinds of variables. So usually it is independent, dependent, and extraneous variables. So independent variable is something the researcher seeks to manipulate. Okay. So it is also called the predictor variable in the sense that it is what causes or is what is thought to cause other things or other changes. Okay. So that is why it is called a predictor variable, or it's not dependent on anything. So it is called an independent variable. So it is assumed to predict or affect other variables. Okay. So this may be active or it may be an attribute. So we'll come back to that active and attribute later. So this is a variable that is usually manipulated. It's used to predict another thing. So dependent variable is assumed to assess the effect of the first one, which is the independent variable. So if you change, let's say, the level of caffeine consumption of a person, right? The person sleeps less or the person sleeps more. So here sleep would be a dependent variable and the level of caffeine consumption would become the independent variable. Okay. So this is thought to be the outcome variable or the criterion of the independent variable. So hence it is called the outcome variable. Okay. So this is what we study in the end. So this is what the effect is. So independent variable is the cause. So then we have like other variables which are not exactly of interest in that study, but they also tend to influence the dependent variable. So we call them as nuisance variables, control variables, or sometimes we can like add to the research and call it a covariate. So examples could be like socioeconomic status, okay, or their earlier sleep patterns. So if you're studying, let's say, effect of caffeine consumption on sleep, so you could think that the person's earlier sleep pattern could also be a variable that is intervening, right? So that could be something that is called an intervening or extraneous variable. So if the person usually sleeps less and now they are also sleeping like way lesser, so that is because of their earlier patterns. So it is not probably just because of caffeine. Or you can talk about whether they were already like having a lot of caffeine like earlier before the experiment. So that could also influence your current study. So these are something that are like called extraneous variables because they influence your study, but you're not currently having them or you're currently not manipulating them. So these are called extraneous variables. Right. So now we had variables and we also have to like operationally define them. So before that, let's just see. And we do have. Okay. So before taking the variables into the study, we have to operationally define them. Okay. So the way we operationally define them determines what the variable becomes. So is the variable going to be like independent or is it going to be like a dependent variable? So operational definition describes or defines a variable in terms of what it does or how you're going to measure it or how is its effect observed, right? So that is what an operational definition of a variable is. So we already seen the definition of an independent variable. So I also told you an independent variable could be an active variable or it could be an attribute variable. Okay. So independent variable of course is a predictor variable. So when it is an active variable, so that takes the form of something that can be manipulated. Okay. So if you can manipulate an independent variable, that is something we call an active variable. So if you give someone a particular intervention, okay, so that becomes an active variable. If you give someone, let's say, a particular drug, that becomes an active variable. But if you're going to study gender differences in a particular behavior, gender differences in risk taking, gender differences in choosing a particular career, right? You cannot change the gender of a person. So that is not an active variable, but it's an attribute. Attribute in the sense it is already a pre-existing attribute of the person or the group of people you're studying. So for ethical reasons, sometimes active manipulation may not be possible. For example, if you're studying the relationship between cancer stage and quality of life, you cannot change a person's cancer stage and like make it worse, or you cannot make it lesser just for the sake of studying it. Okay, so there that would be an attribute variable where you choose people having like that particular stage of cancer. If you want to study people with fourth stage of cancer or third stage of cancer, you cannot give them that stage of cancer. So you're going to like choose people who are already suffering from that stage of cancer, and then see their quality of life, and then probably like see their cognitive abilities or something like that. So that is called an attribute variable. So independent variable can take the form of either active or attribute variables. So studies with only attribute variables are kind of like called ex post facto studies. So where you like study them after the fact. So it's not mentioned here, but that. And the types of independent variables here. So it includes both attribute and active variables, but there's a lot of difference in their interpretation. So active variables are often used in experiments. Okay, so often less in quasi-experimental experiments where you can manipulate them. So they're like experiments where you want to study the effect of something. So even in the research problem, so you'll have to study the effect of this particular drug on, let's say, Parkinson's or some disorder. So that is going to be an experiment where the variable is an active variable. If you want to see the relationship between this and this, if you want to see the difference in between two groups, right? Attitudes towards a particular group of like males and females. So that is again gender difference, right? Here you cannot assign gender to a particular individual. So the person already has their gender. So that would be an attribute variable. So here you're not going to use any experimental methods. It's kind of like ex post facto. So here you cannot like give them a causal relationship. So in the attribute variable, so you can like the active variable, you can say this independent variable is what caused the change. So cause and effect relationship can be established there, but in independent variables which are attribute, the cause and effect relationships cannot be established because they're already present there. It can only be the difference, but it cannot be causation. So that is one of the qualities of an attribute. So where you cannot like establish cause and effect. But in active independent variables, you can like say this variable caused this change. So that is another quality or an operational definition of it. So we also have like levels of the independent variable. We have levels as in like the ranges or the different settings an independent variable can take. Okay, so that is what we call as levels of independent variable. Okay. So we have like several terms like values, categories, and all that indicate levels of a particular variable. So in an experimental study, you can have, let's say, an independent variable. So where you give a treatment. So the treatment can be given for 2 days a week, or the treatment can be given 4 days a week, or it can be given all 7 days a week. So we have like different settings of it. Okay. So when you have like different settings of it, which are in a particular order, we call that level. So in level 1 of the treatment, we have like 2 days of treatment. In level 2 of the treatment, we have like 4 days or 5 days of treatment. In level 3 of the same treatment, we have all 7 days of treatment. So it will be like low, medium, and high. So in the second image that you can see here, so this is an example of such a treatment which has low, medium, and high setting. Of course, we'll have a no treatment group, which is usually the control group. Okay. So we can have like two different treatments as well. So those two different treatments can themselves have different settings as well. So those are the different levels of it. So these are the various possibilities. So the possibilities are again endless. So you can have just two treatments, or you can have like two treatments with 3 levels for each treatment. So those things can also be there. Or there could be no treatment, just different values like gender, male and female, like the gender studies, so the gender differences, right? So when you have like two different independent variables, so that is where the independent variables can interact. So that is something that is called a factorial design. So in this one, we have treatment 1 and treatment 2, right? What if the treatments are mixed together, right? So what if a person having treatment 1 also takes treatment 2? So now the independent variables are like two different independent variables are there. So such treatments are called two-factor or factorial designs, where two independent variables are allowed to interact with each other, and then you see the study. Okay? So these are the various levels. So the levels can be like either entirely separate, or they can be allowed to interact as well. So even with the separate or the interactable settings, they can be like of various settings, like high, medium, or low. So if you have doubts, we can like put in the question. If you want an example, or if you have an example to say, you can like put it in the chat box. So if you understood the levels of treatment or levels of an independent variable. So we'll be moving on. So questions may be asked, like let's say in a factorial design, a particular treatment has high intensity. Okay. So what if a person with high levels of caffeine consumption and low levels of sleep does a particular exam? So what could his level of efficiency be? So that could be studied using a particular design. So what design could it be? So if you know it, you'd say it's a factorial design or a two-factor design, right? So those sort of questions can be asked from this particular. So dependent variable is like something we already seen earlier. So it is what is assumed to measure the effect of the independent variable. It's the effect variable or the outcome variable. It's thought to be the presumed outcome, so it's called the outcome variable. So the ways in which we have like dependent variables are like test scores on questionnaires or performance on a particular exam or something like that, or reading from instruments or measures of physical performance, right? So they're all dependent variables. So they're like after the independent variable, you study their effects. So like independent variables, they can also have like several values, right? So they can range from one setting to another. So if people answer by yes or no questions, they only take two levels. If they're answering on a Likert scale, so it ranges from strongly agree, neutral, disagree, and strongly disagree. Now that's like 5 levels, right? So like independent variables, dependent variable can also have several values or several levels. So lastly, we have extraneous variables. So these are something that is supposed to be mental research, also in correlation studies as well. Okay? So extraneous variables control the study outcome itself, right? So if you take socioeconomic status, okay? So if you do take socioeconomic status can influence the amount of exposure a person has in terms of education, right? So just because a person is doing well on like say a achievement test, so it does not mean that it is only because of a particular interaction or a particular therapy. It could be due to socioeconomic status and other things as well. Okay, so that is what we call as extraneous variables. So we have a lot of environmental factors. So the the room temperature in which you're like studying, the time of the day. So they also can influence the amount of score you get on a test, or the teacher who teaches their subject, right? So they can also influence the score on a test. So these are not things we usually take into consideration in the research, but they do play a major role. So these are like extraneous variables. So one such way of controlling them is random assignment, something we already saw like briefly earlier. So we'll take a brief break here with this.